Hello, I'm Mr. Shrum, and I'm back again with anatomy lesson walkthrough of 3.3. We are talking about articulations, which is another name for joints, and we talked about how we classified joints last time, and we focused on synovial joints because those are the ones that allow us to actually articulate and move our body the most. And today we're going to look at principal joints of the body. Principal joints, from your head to your toe, you have joints all throughout your body. The synovial joints are the very movable diarthrotic joints, and they can go all over the place. Well, for the most part. And the principal joints in the body include the temporomandibular joints, the sternoclavicular joint, the glenohumeral joint, elbow joint, metacarpophalangeal joints, interphalangeal joints, coxal joint, tibiofemoral joint, and the talocrural joint. The temporomandibular joint is formed by the mandibular condyle of the mandible and the mandibular fossa of the temporal bone. So we have the mandible right here, and then the temporal bone up here. And right between those, we have the temporomandibular joint. It's actually the only synovial joint in the skull. It's a combo of a hinge joint and a gliding joint. The hinge joint of this temporomandibular joint allows the mouth to lower and rise. The gliding joint allows the jaw to protract and retract. It's also able to do lateral rotations. So go give it a try, move your jaw around and see on what part of your face, see I'm doing it right now, if you can find that joint. At least get close. The sternoclavicular joint is formed by the clavicle and the manubrium of the sternum. It's a gliding joint with a decent range of motion because it has an articular disc within the joint capsule. The glenohumeral joint is your shoulder joint. It's formed by the head of the humerus and the glenoid fossa of the scapula. It's a ball and socket joint. This joint is also the most freely movable joint in your body. And how it achieves this mobility, it has to sacrifice stability. And this is why shoulder dislocations are common. A shoulder dislocation is where the head of the humerus comes out of the joint capsule. The elbow joint is formed by two separate articulations, the trochlea of the humerus and the trochlear notch of the ulna. The capitulum of the humerus and the head of the radius. Yet the elbow joint still only has one joint capsule. Within this capsule, there is a large olecranon bursa to aid in lubrication of the joint. The elbow joint is a hinge joint. The metacarpophalangeal joint is your knuckle joint. Your knuckle joint is formed by the oval convex end of the metacarpals and the concave depression of the phalanges. It is a condyloid joint. And then within the phalanges, further towards the tip of your fingers, you have the interphalangeal joints. And those are hinge joints. They can only go one way. The coxal joint is your hip joint, and that is formed by the head of the femur and the acetabulum of the os coxae. It is, or coxae. It is a ball and socket joint as well. It's stronger and more stable than your shoulder joint because it actually has to bear the weight of the body. Your shoulder, it doesn't have to deal with as much weight. So it can get away with being a little freer, a little looser, more loose. Then you have the tibiofemoral joint, and that is your knee joint. It's formed by the femur and the tibia. It's the largest joint in the body, and it's also the most vulnerable joint. And in order to protect it, it's super complex, at least more complex than other joints. So we're going to take a look at that more in depth. And the tibiofemoral joint is a complex hinge joint. So in addition to flexion and extension, it allows a limited rolling and gliding movement as well. So within the tibiofemoral joint, it has many structures that surround it to help protect it. On the anterior side, we have the patella and the patellar ligament, the patellar retinacula. And then on the posterior side, behind your knee joint, we have the popliteal ligaments and the cruciate ligaments. And then on the medial or lateral sides, we have the collateral ligaments. The patella does not articulate with the tibia or femur. Actually, it's a free-floating bone. It helps to stabilize and protect the anterior side of the knee joint. It connects with the patellar ligament to form the patellofemoral joint, which is a gliding joint. And that can be seen here. Also on the anterior side, on the front side of this joint, there are two supportive bands formed by the quadriceps femoris, known as the patellar retinacula. And that is located right there. From the vastus lateralis, the lateral patellar retinacula is created. From the vastus medialis, the medial patellar retinacula is created. And on the backside of your knee joint is known as the popliteal region. It has several ligaments that support it. And those two are mainly the popliteal ligaments and the cruciate ligaments. Cruciate. The popliteal ligaments are superficial ligaments. And there are the broad oblique popliteal ligament and the arcuate popliteal ligament. The cruciate ligaments are deep ligaments that cross each other to help stabilize the knee joint. There are two cruciate ligaments. The anterior cruciate ligament, known as the ACL, if you've ever heard of people tearing their ACL, that is where that ligament actually is. And then you have the posterior cruciate ligament, the PCL, back here. So this one's in the front, anterior, and then posterior in the back. This is the top of your knee. The anterior Well, this is a top view. So you're looking down through your knee. And then we have the medial and lateral sides of the knee joint, and they're being protected by the collateral ligament. The names of the collateral ligaments are the medial collateral ligament, the MCL, and the lateral collateral ligament, or the LCL. And those are on the sides of your knees. There are two menisci in the knee joint, the lateral meniscus and the medial meniscus. The medial collateral ligament is attached to the medial meniscus, and the lateral collateral ligament is not attached. So remember, the medial ligament goes with the medial meniscus. The lateral ligament does not connect to the lateral meniscus. So the inside of your knee, the inside side of your knee is connected to the ligament and the meniscus, but the outside of your knees are not, okay? The knee joint also has several bursae, 4 on the front side, the anterior side, 2 on the posterior side, and then 7 on the lateral and medial sides. Then we have the talocrural joint. That is your ankle joint. It's formed by 2 articulations, the medial malleolus of the tibia and the talus, and then the lateral malleolus of the fibula and the talus. This is a hinge joint with 1 joint capsule. And there are 4 ligaments that support the ankle outside of that capsule. The deltoid ligament, the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneofibular ligament. The deltoid ligament is found on the medial side and creates a triangular shape. It extends from the medial malleolus of the tibia to the talus, the calcaneus, and another tarsal bone. The anterior talofibular ligament is found on the lateral side of the ankle joint. It passes anteriorly from the lateral malleolus of the fibula to the talus, right here. Then we have the posterior talofibular ligament, and that's found on the lateral side of the ankle joint. It passes posteriorly from the lateral malleolus of the fibula to the talus, and that's on the back, towards the back. Then you have the calcaneofibular ligament, and that's found on the lateral side of the ankle joint. It passes inferiorly from the lateral malleolus of the fibula to the calcaneus. The principal joints in the body include, as a summary, the temporomandibular joint, the sternoclavicular joint, the glenohumeral joint, your elbow joint, your metacarpophalangeal joints, the interphalangeal joints, coxal joint, tibiofemoral joint, and the talocrural joint. These synovial joints have lots of ligaments and meniscus and bursa to help protect them from injury. And that's the end of that little section. Let me go back And then we're going to look at articulation issues. So what can go wrong with these joints? Well, if the primary function of articulations is to allow movement between bones, a synovial joint is composed of a variety of structures that help to support this function. However, when these fail, that is when issues can develop. Either through disease or trauma, your joints can be damaged, or the supports of those joints can be damaged as well. And in this lesson, we're going to focus on how trauma can actually injure those structures. And these injuries will include sprains, dislocating joints, bursitis, and tendonitis. Now, if you've played sports, you actually may have experienced a sprain. And that's when you tear a ligament that surrounds a joint. Remember back in the muscular issues lesson, we learned about a muscle strain. That's when you actually overstretch or tear muscle fibers within the muscle. This is tearing the ligaments around a joint. And one tip to help you keep them straight is strain is a tear of a muscle or tendon, whereas sprain is a tear of a ligament. Okay, so you have to keep those two. Technically, they're different, right? So strain has a T in it, so think of tearing or tendon. And then sprain is a ligament instead. But they both have similar symptoms. You may hear a pop, sudden onset of pain, soreness, stiffness, weakness, swelling, bruising, limited ROM or range of motion. In a sprain, the swelling is located within the joint capsule, and that's known as synovitis. So what are some of the risk factors? What happens right before you're sprained? I don't know why they're like all smiling in this picture. It's kind of strange. But they're very common. A sprain is caused when a joint is knocked out of position, causing a lot of force, too much force on the supporting ligaments. And that can occur due to a direct blow to the joint if your joint gets hit, or indirectly if you are hit and then that makes you take a strange step or awkward position, and that can damage the ligament as well. An example of an indirect cause would be falling on an outstretched hand or rolling your ankle, right? That can occur to individuals in the general population as well as elite athletes, right? You've heard of athletes getting hurt before, especially when they're performing at the high level. There's more chance of injury because they're playing a lot more, because that's their job, right? Like for us, we have hobbies, we play sports occasionally, but not every day. At least I don't play, 8 hours a day every day. If you practice and don't take proper care, these things can occur. For example, ankle sprains are most commonly caused by an excessive inversion of the foot, causing damage to the anterior talofibular ligament, the calcaneofibular ligament, and or the posterior talofibular ligament. Well, that's all nice, but say it does happen to you, what do you do? Well, we go with the Rice method if it's mild or moderate, and remember that from the muscle sprain. muscle strain, right? Strain, muscle strain, ligament sprain. But rice, you rest, give your body time to recover on its own, and try not to use the muscle where that ligament is. And as pain begins to decrease, you can slowly get back into using it. Ice is another way to combat pain. Icing for 15 minutes several times a day, using an ice pack or taking a cold ice bath. Compression. This is to reduce swelling. You can wrap the injured muscle with a bandage, and that will protect the area and reduce the swelling and hopefully encourage you not to move it all the time. And you don't want it too tightly because blood circulation, you need blood to get in there. So don't compress too much. And then, if possible, elevate the area above your heart, and that can reduce the swelling. You can also take NSAID or non-steroidal anti-inflammatory drugs like aspirin, ibuprofen. They can also be severe as well. Like if you sprain your knee and damage some of that cartilage and menisci, like an ACL tear, that can actually require surgery, which is, harder. It's going to take you longer to recover from. Yeah, so hopefully that does not happen to any of you in the future. Well, how do you prevent sprains in the first place? It's kind of like the prevention for muscle strains. Warming up, good posture, proper form. And when you begin a new program, don't go 100% immediately. Listen to your body. If it hurts, don't do it. If you feel some amount of pain, don't like go through with it just because. Let your ego go, because this happens and you don't want to injure yourself any further than you already have injured yourself, right? Wear protective equipment when playing sports like football, wear pads, shoes that give you ankle support as much as possible, stuff along those lines. The next issue is joint dislocation or luxation, and that is the misalignment of the articulating bones. So common joint dislocations, your shoulder, hip, knee, elbow. That can be a complete separation or even a partial misalignment. And that's called a subluxation. So here's a normal shoulder. Here's a dislocated anterior, so it's moved forward, and then posterior, it's moved backward. The shoulder, the glenohumeral joint, is the most freely movable joint in your body. And to get that mobility, it sacrifices stability. So it moves a lot, but it doesn't have the stability like your hip joint does. A subluxation of the shoulder joint is when the head of the humerus is partially out of the joint capsule. A complete dislocation is when the head of the humerus is all the way out of the joint capsule. Symptoms include swelling, numbness, weakness, bruising. A doctor will put the head of the humerus back into the joint capsule. It is important that you do not try to do this yourself because there are several nerve endings and blood vessels that you could damage if not done properly. Prevention: exercise regularly to build strength and improve range of motion. Try to avoid falling as much as possible. Wear gear when playing sports. Just be smart about things, really. Then you get into bursitis, and that's swelling or inflammation of those little bursies. And those are the little sacs filled with synovial fluid around the joint. And that can occur in any of these. So common ones are the shoulders, elbows, hips, knees, heels, and big toe. Then you have tendonitis. That is also inflammation or swelling of the connective tissue that connects a muscle to a bone. Tendonitis can occur in any tendon. Some of the common ones are tennis elbow, golfer's elbow, pitcher's shoulder, swimmer's shoulder, and jumper's knee. So, what are the symptoms of these? Swelling, redness, bruising, pain when touched or moved, sharp shooting pain. What are some of the risk factors? Well, age. As you get older, more inflammation is common. Your job, hobby, or sport, especially if they have repetitive motions, can be risky. Systemic diseases like arthritis, gout, diabetes are also risk factors for bursitis. You can treat these issues with rice, just like sprains, but if it goes further, then you may need more intense treatments like therapy, corticosteroid injections, or surgery. How do you prevent it? Well, knee pads when you kneel, wheelbarrow rather than carrying heavy items, take breaks, maintain a relatively healthy weight, and warm up before exercise. How do you prevent tendonitis? Well, add a little variety to your workout so you're not doing the same repetitive motion all the time. Allow your body to rest after a workout. Don't forget to warm up beforehand as well. And then be aware of your posture while at work. But that's the end of the articulation section. To summarize, injuries to your joints can be super painful. Exercising and stretching may help prevent joint injuries. And yeah, thank you guys. And I will see you next time. Good luck with everything. And yeah, goodbye.